And that core Oh, thank you. That Core 4 partnership is actually something that Community Action is engaged with in our youth services. So we have the opportunity that we are really focused on the early childhood portion of a lot of these ideas that were outlined by the Youth Master Plan, and that our Youth Services Commission is able to really focus on a lot of those issues with some of those older kiddos, adolescents, high school age. So also in 2020, our coalition became an official Start Smart coalition. And in 2022, we got funding that we were able to utilize the Bright by Text platform, which we still do. And then last year, 2023, so much happened. So Community Action, being sort of the anchor agency for this coalition, received additional funding to implement Help Me Grow as a statewide initiative that they want to see Help Me Grows in all the counties in Texas. That's the goal. I was hired on to support the coalition as the coordinator. And the coalition merged with United Way of Greater Austin in order to fully implement the Help Me Grow model, and which is now going to be Help Me Grow Central Texas. So lots of things happened in 2023. We've been working up to this, and now there's lots of new projects coming up. So just a review of our mission and goals that are currently standing. And I would love, as I'm reading through some of this stuff and sort of, touching on some of this stuff, I would love to hear any thoughts or suggestions or comments you have on some of these things. The intention really is to change and update a lot of these so that we're really more focused on serving the community needs in the present. And like I said, a lot of these things were created, 3 or 4 years ago and pre-COVID, right? So things change. So please feel free to share your thoughts. I would love to hear. So our mission is, can't talk today, promoting kindergarten readiness, family engagement, and community health and wellness through collaborative planning and empowering families. Very broad, perfect. Our vision: every child will have the resources to be happy, healthy, and successful in a thriving community. And then the goals that we implemented, or the goals that we identified to help us get to those things, right, are that we want to improve community health and wellness, promote kindergarten readiness, and improve family engagement. And so the idea is that through the implementation of different programs and strategies, that we'd be able to reach those goals and, really support the families and the providers in our community. So the way that we have been utilizing data to see, are we, is the needle being moved on any of these things, right? So there's a couple of different measurements, and I put a QR code here if you would like to scan that and follow along, or you can, scan it and look at it later. But we use what's called an RBA scorecard. RBA is a collective impact initiative that's results-based accountability. And in the coming months, we're going to be learning specifically more about what results-based accountability is and what collective impact is. Megan and I are going to be doing a training on this coming up in the next month or so. And Alex also is someone that is very well versed on collective impact and results-based accountability. But the idea is that, we want to be sure that we're not just making lofty goals that we don't really know how we're going to track or how we're going to measure it. We want to know specifically how we're going to track these goals so that we can see if any progress is being made, and if there's anything that we're doing or can be doing to help move the needle on a lot of those things. So the data points that we are currently following and tracking are these right here. So the percent of Hayes in Hayes and Caldwell live births who have had prenatal care beginning in the first trimester, right? So that goes back to health and well-being. The percent of Central Texas children who receive at least one developmental screening in the first 3 years of life. We know that we want kiddos to have way more than one in the first 3 years of life, but at least one in the first 3 years. The number of confirmed victims of child abuse and neglect in Hays and Caldwell counties. The number of children in Hays and Caldwell estimated to be food insecure. The percent of Central Texas children deemed ready for kindergarten, and deemed ready for kindergarten, those metrics are, I believe, created by TEA. Is that right, Alex? That those, like how we define ready for kindergarten?
So we're actually using data from E3 Alliance because unfortunately we have representation from so many different school districts, and every school district has an opportunity to use their own whatever tool they want to that's approved by TEA to measure kindergarten readiness. So it's not quite as easy as just comparing the data that each school district submits annually in regard to their school readiness rates. And so, yeah, E3 Alliance does that data collection in the Central Texas region to be able to track it because of that issue with that data collection.
So yeah, and I think as we look at some of the strategies that we're going to look at real quick for each of these measurements, that makes sense because one of the strategies was having a definition that was shared, right? Yeah, perfect. So percent of Central Texas children deemed ready for kindergarten. The number of high quality childcare providers in Hays and Caldwell counties, and then the number of days per week adult caregivers read to their children. So these were some of the metrics and measurements that we've been trying to follow over the years to see sort of where we are and what sort of impact different initiatives might be having. So as we're looking at some of these measurements, just sort of like what we're following here, does anyone have any thoughts or questions or even suggestions on additional kinds of measurements that you know, are interested in seeing or that you utilize regularly when you're trying to, you know, strategize for your own work? No worries. I know everyone is still a little, and I realize this is very info data heavy. So my intention is to go through this, but then also we'll be following up with an opportunity for people to really provide some more feedback in that way. You know, with a different sort of form and sort of to elicit more suggestions and feedback and everything as we go back and review this. So don't worry, you'll have more opportunity to share your thoughts. Okay. So we're going to touch on each of these because each of these has different strategies. And so these strategies are really something that, you know, might be the right. If we're looking at those data points might not be something that we change, but the strategies and how to get to those data points might be something that we want to change, right? So the first one is that we want to promote prenatal care beginning in the first trimester. So far, the strategies we have listed for that are 3 of them. To create targeted advocacy to community groups, helping them to understand the importance of prenatal care and become champions. So that looks like community outreach, right? The second strategy is to grow the coalition by directly reaching out to new partners with specific roles to play or contributions to offer. That's something that, you know, I know has been more difficult, and that is something that I know that I'm working on, particularly now in my role, is that I have the ability to really try to reach out and figure out who is a good fit for the coalition, who is, you know, who in their specific role could be someone that could help move the needle in some of these areas. And then the third strategy, implement the caravan model that puts information and resources directly into underserved areas of Hays and Caldwell counties. So when we're talking about promoting prenatal care beginning in first trimester, Generally, these strategies are about getting information into the hands of parents, getting providers to make sure that we are giving the correct data about the importance of receiving prenatal care in the first trimester. So any thoughts on those strategies? And here we have, so if you go to the RBA scorecard, and I will go ahead and include that info in the follow-up email as well if you missed the QR code, that you can see where the data is right now. Some of this does need to be updated. And like I said, I was out sick with COVID last week, so I didn't get a chance to update some of it the way that I would like to have. The difficulty with a lot of these is that we are pulling information from so many different places, and not all the information is on the same timeline. So they may only receive or, assess this every couple of years. So all the information coming from different places with different timelines makes it look a little wonky. But this is what we currently have up on the RBA scorecard. So percentage of Hayes and Caldwell live births with prenatal care beginning in the first trimester. What we're looking at is the time period, the actual value that is current, the trend, and then the baseline percent change. So according to this, right, which goes all the way, which unfortunately only goes up to 2017, it was looking like we were having a pretty positive increase in people that were getting prenatal care beginning in the first trimester. We know, and when this data is updated and will be updated soon, we know that COVID had an effect on this. So it will be interesting to see what effect COVID had on parents and caregivers getting prenatal care in the first trimester, and what we could do to help support that. So the second part of this were that all children will receive at least one developmental screening in the first 3 years of life. So the first strategy was build a community development structure that promotes the importance of early developmental screenings, including faith-based networks and businesses. I feel like this first strategy is something that help me grow, hopefully will really help to promote. That is sort of the whole purpose right there, right? Is like having a community structure, a community model to help promote these things. The second was to develop and train staff from stakeholder organizations and schools on how to support parents to apply for Medicaid and CHIP, because we know that if they have Medicaid or CHIP and that they're going to their well child visits, that they will most likely get a developmental screening. The third is provide community-wide universal home visiting to parents of newborns through Family Connects. And Alex, do you want to speak on that just a little bit? Because since Megan's not here, about the Family Connects part of this. Oh, you are here.
I got in.
Yay.
Nina and I were having some technical difficulties between our Zoom accounts.
Yeah.
I don't want to interrupt if Alex has something to jump in and share as well. Family Connects is a home visiting model that works through the hospital systems to connect new parents directly with a home visitor that does short-term home visiting. So like a maximum of like 5 or 6 visits postpartum after they leave the hospital. And what's really neat about Family Connects is not only is it nurses doing the home visiting, but the intention being that that person be kind of a jumping off point of community resource connections for early childhood for all families. So the model of Family Connects is universal, that if Family Connects is available in a community, that every family that is in the hospital is going to be offered some kind of service. And then therefore ideally connected on to other early childhood supports in their community. I was not around for the strategy planning of this though, so I don't know, Alex was, if she has anything to kind of add to that.
Yeah, I mean, it really, the reason that this one really floated to the top in the discussions that we had years ago was because of that universality. There aren't a lot of models that are universal in nature, where every single family, regardless of income, is receiving the same exact service. And what the reason that that was so intriguing to the partners was that it creates very quickly just a normalization of that as just the thing that everybody gets. And in doing that really ensures that families know how to get the support and the services that they could potentially be accessing, because that tends to be, you know, one of the biggest challenges is that families don't know all of the resources in the community. I mean, there are those of us who do this work professionally who are like, oh, that's new, right? So how in the world could families know? So yeah, that was really the excitement that folks had at the time.
Awesome. Thank you guys for that. You know, because it really puts it in perspective, right, about what it looks like to have that universal model, and sort of how this, you know, kind of lends to more connection to the community, Megan, like you were saying. So thank you. And then the next one was to expand evidence-based approach of engaging parents and caregivers in their home environments. And you know, as a former home visitor and you know, I feel like this strategy in particular has been something that was that we were definitely more able to implement and have some more control over, right? And as the home visiting program, as parents as teachers, is expanding as well across Hayes and Caldwell County. So I feel really good about that, that one specific strategy. Okay, so moving on. And so then this is what where the data is landing right now. So the percent of Texas children who receive at least one developmental screening in the first years of life. The data indicates that the years leading up to 2021, that was definitely in decline. And we know that coming up, you know, through the pandemic, that it was really difficult, right? Parents weren't going to well child visits as much as they were going before. They were having a lot of difficulty just accessing services in general. So this is definitely one of those specific measurements that we're really looking to build new strategies on. So the next was to reduce cases of child abuse and neglect in Hayes and Caldwell counties. Strategy 1, to promote positive interactions with young children, expand the evidence-based approach of engaging parents and caregivers in their homes with PEI funding. So that goes back to our home visiting models. The second was to reduce the food insecurity families experience when living in households that are struggling to make ends meet, providing universal breakfast and lunch. To prevent escalation, conduct relationship-based, individualized case management directly linked to instances where children are identified for being at risk for child abuse and neglect. That, you know, I feel like really speaks to, at least from our home visiting program, trying to build more relationships with CPS and stronger referral systems with CPS and other agencies. And to promote bystander intervention for child abuse and neglect, increase bystander awareness and empowerment by implementing the Green Dot program in early education settings. And Alex or Megan, I don't know much about the Green Dot program. Can either of you expand on that a little bit?
Alex had to hop off. I am not familiar with the Green Dot program. I don't know if any of the other professionals in the room who are. But yes, and like I said, I was not a part of the development of this strategic plan. So yeah. I'm not super familiar with it, and this is exactly why it needs an update.
Yeah, perfect. Awesome. I just wanted to check in, yeah, because the Green Dot program was something that I was just unfamiliar with. But you know, I'm assuming, and that it is some sort of awareness, sort of how to identify children who may be being abused or neglected in early education settings. So that goes back, I think, a lot to sort of supporting that workforce development. And this was where our metric was, or is at the moment. So number of confirmed victims of child abuse and neglect in Hays and Caldwell County that have increased up to from 2017 to 2021. Once again, thinking about how COVID really impacted a lot of the families that we serve. We know that children are at greater risk for abuse and neglect when families struggle with basic needs. It increases stress in their households. And so this is definitely a metric that we, are looking for opportunities for more intervention and more initiatives that we can focus on as a coalition. So the next one was to reduce food insecurity for children in Hays and Caldwell County. Unfortunately, there were no strategies that were specifically defined for this metric. And a lot of these strategies, even across the board, some strategies had specific action steps. A lot of them did not. So definitely, the plan was created, and it without the ability to have a lot of intention towards it. We were looking at sort of something that maybe just didn't have a lot of specific action steps behind it. And so that's really, as you're hearing these things, right, and you're thinking about the communities you serve and what specific action steps we can take as a coalition and how we can support families and providers, these are the things that I really want to hear. Oh, here comes Sandy. So that we can, reinvent this a little bit. So the number of children in Hays and Caldwell estimated to be food insecure was dropping for a number of years between 2017 and 2019. And then, as you would expect, increased again in 2020. The next one was to ensure all children are kindergarten ready in Hays and Caldwell counties. And like we said, I think a big struggle with this too has been that there is no common definition or common way to measure this from district to district. We know Texas likes to leave things up to individual cities, states, districts, et cetera. But that can cause a lot of confusion, I think, across the board. So the first strategy was to provide access to quality early learning opportunities through formal programs and interventions. So lots of this has to, going back to our Texas Rising Star initiatives, right? And our workforce development. To engage informal care providers to strengthen the quality of care while respecting their autonomy. And like we mentioned, develop a shared understanding across Hays and Caldwell counties about what school readiness means and what it includes. So, just starting with how are we defining this in our school districts so that we can all be focused on the same goals. And so this is what those metrics were looking like for the percent of Texas children deemed ready for kindergarten. It seemed to be pretty steady with a drop in 2015. And then sort of rising a little bit and then dipping towards the end of 2019. And once again, thinking about how COVID affected this after that. So we know that children are less kindergarten ready right now than we've seen in a lot of different in previous years, just because they weren't getting the same opportunities for social interactions. A lot of childcare providers had to close their doors during this time, so it's definitely been a struggle. So these are definitely a lot of opportunity for us to come up with some ideas here and how we can support providers, childcare providers, and the school district. So the next is support high quality childcare providers in Hays and Caldwell counties. So to implement Reaching for the Stars. To increase the number of childcare centers that are progressing towards achieving 3 stars or higher with Texas Rising Star, to pursue early Head Start childcare partnership grant funding to improve quality of existing childcare facilities, and to develop a demand for quality early childhood education by educating parents about what it is to have a Texas Rising Star high quality early childhood provider, an education provider. So I know that we have been, we've got folks on the call right now who are part of Texas Workforce Commission and very engaged in the Texas Rising Star program. So I don't know if you guys have any thoughts about these specific strategies that were outlined a few years ago.
Hey, this is Erica with Workforce Rural Capital Area. I think that these are all great, and I'm excited to say that behind the scenes, we're working on a few things to hopefully support some of these strategies. I'd be happy to speak to some of the initiatives we have coming up for childcare providers currently and in the near future. And one of which I think you'll be talking about too is these training opportunities, and we're working on some high quality training opportunities for providers as well.
Awesome. Thank you. So I'm just curious, Erica, do you feel like these strategies are still fairly relevant and kind of on point, or do you feel like that's, something maybe that needs to be a little updated?
That is a big question. Yeah, I think they are on point. I know right now we're making a huge push just to get people, our childcare providers, on board to be in the Texas Rising Star program in general. And so I think that's our big push right now, is getting everybody on board. And then down the line, I think we'll be looking at 3-star quality.
Okay.
No, but I think
Awesome.
that these are pretty relative. Yeah.
Awesome. And are there any, I guess, what have been some of the main challenges with getting providers on board with Texas Rising Star?
That's also a great question. I see Sandy Anderson is on the call. She may be able to speak to this a little bit more than I can, because she is the one who's got boots on the ground and is really involved in that process.
Awesome. Sandy, are you able to chime in on this? You might be doing something else too. Okay, she might be doing a couple of things at once here, so but definitely some questions that I think would we will be exploring more. And the goal here, right, is to sort of just familiarize everybody with what we have been wanting to do, update it as needed. And this is going to be something that we work on with our steering committee. But what I really would love is what we need to be able to work on this is just feedback. So, and once again, for those of you who missed it, there's going to be opportunity to give feedback through email. I will send a survey to where you guys can kind of look at these things again and provide any feedback, thoughts, or suggestions that you have, so our steering committee can really do the brunt of the work and sort of redefining anything that needs to be redefined. So this is where we were in our metrics, in the number of high quality childcare providers in Hays and Caldwell counties. That this goes up to 2022, which is pretty great. And unfortunately, though, as we know, from 2020 to 2022, like I mentioned before, a lot of places had to close. Childcare became really difficult to access. And so there's been a lot of time and attention and thought being given to how we can support more quality childcare providers as they begin to emerge and open once again. So the next one was increased number of days per week adult caregivers read to their children. There weren't any specific strategies listed, and I know that this is a specific measurement that parents as teachers measures across the board, and it's actually something that is going to be part of their new CQI project. And so if keeping this as part of our strategic plan, right, because the goal is that we want to increase the positive interactions that caregivers have with their children, and you know, how that will get to, oh, she can't get off mute. Okay, thank you, Sandy. Yeah, just let me know. We can always circle back, or we can always you know, talk about it at our next meeting. Um, but yeah, so this is going to be something that we can definitely get more information on, hopefully soon. Megan, did you want to speak to that?
Yeah, I was just gonna say, this is actually a McV
Yeah.
benchmark. So this is a federal data point that's being collected through HRSA, through the McV grant. So the Maternal, Infant, and Early Childhood Home Visiting Grant is a federal grant that then is dispersed through the states. Community Action is a recipient of some McV dollars. So this is a data point that we look at. You know, I again, not to just continue repeating myself, I was not a part of the original planning and kind of looking at these strategies. However, I think you made a great connection point to looking at these early literacy rates in conjunction with positive interactions with caregivers. There's tons of data that and research that shows us that reading and early literacy has impacts on language and attachment and educational attainment in general. I could not tell you off the top of my head exactly the reasoning that HRSA had for putting this as one of their McV data points, but just a little bit of context to this. I imagine as well that in the kind of formation of these strategies and for the coalition, this is free data that we are already collecting. And I imagine that that was also a motivator in including it here, because as we know, there's all sorts of supporting research that says that reading to children makes a difference. So.
Yes, and that is such a good reminder too about sort of our coalition's ability to share data amongst, you know, for the purposes of sort of measuring these things and for the purposes of our strategic planning. So because, as Megan said, right, this was data that we could easily get. So it was something that was like, well, let's go ahead and follow it, right? Let's make it part, you know, because of those links between literacy and kindergarten readiness and family engagement and all those good things. So that, you know, is a good reminder that if you and your program, that the data that you are currently collecting, right, if you feel like there's something that can be brought to the table to sort of as we redefine these strategies or find new ways to measure them, you know, please, we would love to kind of collect that data and make that part of our mission and goals, right? So that we can try to move the needle on some of these things. So that's a good reminder. Thank you. And this one goes up to 2018. And so it was looking very positive, but I would love to see what it looks like later. And Patricia asked if libraries collect this data. And so I think that's a really great, you know, if we want to focus on literacy efforts as a measurement of kindergarten readiness or family engagement, et cetera, I would be interested in knowing if the library collects anything like this. I know that they are very careful about collecting data, and I'm not sure if our library representative is on the call right now, but from my understanding is that they collect very little data because they like to be sure that they are protecting the identity of all of their patrons. So they don't collect a whole lot of specific data. But it would be interesting to know different ways that we could maybe measure this. So with all that being said, you know, we have an intention of updating this plan. Like Megan mentioned, right, neither of us were part of creating the strategic plan. And this was definitely created with a lot of different things in mind, because the Youth Commission was still was still part of this. There was a lot of things that were going on at the time that led to the creation of those specific strategies. So what it looks like for us to serve our community now, post-COVID, with a lot of the issues and challenges and barriers that we identify with our community all the time. So just, thinking about where we are now and, what is the landscape today. So that's something that we just sort of discussed a little bit. And, I'll be following up to gather information. So what are we doing? What are the community needs? When you're reviewing this, and later on, as you're thinking about it, or maybe discussing it with some of your colleagues, what are some specific goals or strategies that you think that this coalition should be engaged in? These are all really great strategies, but we definitely want to make sure that we're doing things with purpose and intention so that we don't just name things and then not really know how to follow up with it. So definitely, I'll be sending out in the next, probably next week, I'll be sending out a short survey with a link to that information so that you can review it and so that then you can have the opportunity to more thoughtfully give some feedback on those things. And that feedback will be given to our steering committee, and the steering committee will continue to sort of rework and retool these things. And we'll kind of just go back and forth with that a little bit over the next couple of meetings. We'll take a little bit of time to kind of just review some of the suggested changes and recommendations, and until we come up with something that that we can all really get behind. And it's such an important thing to make sure that we are updating these and that we all can get behind this. And that we are all aligned on these mission goals and strategies, because that'll really strengthen our coalition and our work together. Let's see here. Sandy says, perhaps a map that shows children and families involved in Hayes and Caldwell. Measure the increase in books beginning at birth participation for literacy. Oh, that would be wonderful. Yeah, I was just learning about books beginning at birth, so that was a new thing for me. So thank you. I love new ways to get information. So that is our plan. And so we're going to be looking at recreating a strategic plan to carry us through the next 3 to 5 years. We definitely want to figure out how we can assess, our current coalition engagement. We want to increase coalition engagement and the resources that we have and how we can share our resources. And then using the existing data points, like I said, the stuff we have now, and then whatever you feel, right? If there's something your agency is already doing that can be added to these, and then we'll update things as needed. So with all that being said, thank you for listening to me talk for that long. Does anyone have any thoughts or comments or other suggestions that you would like to share when you're thinking about strategic planning, maybe things that have worked for you guys as you do this in your agencies, or anything that you think that, is being missed? Are we missing the mark here completely with some of these goals and strategies? Y'all are all very quiet today.
I'll just to kind of reiterate, I think you definitely mentioned this previously, but with Nina and I going through the collective impact training, we'll be updating our RBA scorecard, and there will be lots of opportunity in the future to think through these things and change things, and maybe there are some strategies that don't feel as relevant anymore. Maybe there are more important goals that have arisen. Like she had mentioned, all of these metrics and goals were set in a pre-COVID world. And so we know that things have changed pretty significantly. So yeah, I'm looking forward to getting an opportunity to go through that process again, keep what works for us, leave some of the rest behind, and move forward. So lots more of this to come.
Yeah, and I think especially as far as building coalition participation, you know, having something that is updated that we feel really confident about, that, you know, as a coalition, we can feel good about tackling these things. And then it will help us better represent ourselves to the community, right? So when, you know, looking at participation from school districts and, you know, from city entities and things like that, right? That they can really get on board with what we're doing. And so then that will increase our resources, that will increase our impact. So, you know, like I said, next steps, definitely collecting information. So please think about this, share that with your colleagues. We want to hear from everybody. So yeah, so thank you, Megan. Okay. So the next thing I want to talk about is something we're really excited about, is our early childhood professional development series. So we are just going for it. And we have created an opportunity for early childhood educators to receive quality education, and, you know, to help them with you know, being sure they're getting their certificates and CEUs and things that they need, but also, you know, being sure that we're finding a way to support workforce development, and that it gives us a platform too to kind of share additional information about you know, events and things going on with early childhood educators. So this is a collaboration. It's one of the, you know, really first Help Me Grow Central Texas collaborations. So this began with the collaboration between our Start Smart Coalition and the Success by Six from Wilco. And then we decided to let it grow a little bit. So we are including United Way of Greater Austin, because that is our Help Me Grow Central Texas family. So this is brand new for us and we're very excited. We have a calendar up, but we haven't completed all of the topics for each one. So this is what it's looking like right now, and we're still building on it. Our intention is to be getting evaluations and feedback from attendees. And then in April, we'll be having a meeting that will be, you know, looking through all that feedback and deciding if things are working well or if we need to adjust anything. And then we'll be continuing to get topics and get trainers on board for the rest of the year. So this is a free professional development series. We have decided on the third Saturday of the month, that from 9 to 10 a.m. At this point, they're just an hour long, but we are, you know, still considering having a few that are maybe a little bit longer. And so this is the schedule that's been adjusted for holidays. I'll be sending this information out again with the follow-up email. And something that we're really excited about is that we're able to offer a little bit of incentive. So $25 Visa gift cards for the first 25 registered attendees who complete that. So really just trying to provide as much opportunity as we can. And the intention behind the gift cards were that we acknowledge that so many educators have to do this on their spare time and that they're not paid for it. So this was sort of our attempt to try to, you know, provide at least a little bit of an incentive. And although we can't pay everyone at this point, you know, that's definitely something that we would like to try to do in the future. We're just still working on everything. So the one coming up for January 20th is Flip It. And this QR link will take you to the registration page that you can share. I will be sending out an email this afternoon to a list of childcare providers throughout Hays and Caldwell County. But please feel free to share this with anyone that you think could benefit from it. And Patricia is on the line with us right now, and she's going to be doing our first one on the 20th. And Patricia, is there anything that you'd like to add or share about the upcoming series?
Just It's a behavior management a strategy and tool. So this was one of the topics that was most needed or most wanting, and so that's why we decided to do this as one of the first topics. But yes, and so that's what we'll be doing, is that flip it strategy. Mhm.
Thank you. And that is a good reminder that, you know, we are trying to be intentional about the topics that we choose. At last meeting, we discussed a little bit about the needs assessment from the Texas Early Learning Council. And so taking into consideration the things that early childhood educators have specifically identified as being training needs or areas that they feel that they are lacking support in. So one of those was behavior management and understanding different types of behaviors, understanding different developmental disabilities, you know, knowing how to talk to parents about when they have concerns or, you know, hygiene issues, things like that. So we are working on being, you know, very intentional about the topics that we choose so that we're making sure that we're supporting the workforce in the way that they've identified. So we do have additional funds to be able to pay trainers. And at the time, I think that we are probably pretty good on trainer availability, but we're definitely always open. So if you are a TechPeds registered trainer, or if there's someone in your agency who would be interested in doing one of these, please feel free to reach out, and we can always invite you guys to the meetings that we have about these. Okay, so next
I
time.
was going to ask a question on the flip it.
Oh,
Is
yeah.
there a specific age group, like 2-year-olds, 3-year-olds, just young children in general?
It's for zero. It's 0 to 3, or well, actually the preschool age.
Awesome.
So, and you can actually use it on adults as well.
That's even better.
So yes.
Thank you, Patricia.
Uh-huh.
That's amazing. And I always, I will tell you on that, Patricia, use it on adults as well. I feel like all the knowledge I've gained over the years as a home visitor have made me a better adult communicator as well. So just personal anecdote. Sherry asked, can these be registered for and viewed later? So we are working on that. So, but yes, we are going to leave I can't talk today. So if you register for it and you're not able to attend, we will be sending a link to the video so that you can watch the video. And for up to a week, I believe if you can do an evaluation, you can still get the CEU. We're still working on that. And so this is all stuff that we're all learning together. But that's definitely our intention. Is to be able to be as flexible as we can. We went back and forth on promoting that or not, and so we were a little nervous about promoting that you know, register or not, and it would be available. And I think the consensus was that we didn't want to promote that information because we wanted people to be there live in order to really get engagement and quality. But yes, but that should be something that we'll be able to do. So thank you for that question. Are there any other thoughts or questions about the professional development series or that one as a whole? Awesome. Yes. All right. So coming up in 2024, community outreach events. So we have a lot of things that we're going to be trying to conquer over the next couple of months. Baby Day is happening April 27th. In Hays County, we are set to have ours at the San Marcos Public Library. And our hope, and we are still yet to figure out if we can do this, is that Dia del Niño will happen simultaneously at Park Plaza, and that we'll be able to instruct families to go from the library to Park Plaza. But we've yet to see if we can get Park Plaza for that purpose. So we will see, but we're really hoping. So send good vibes. And then for Caldwell County, there was some interest in having a baby day there. And I think that we're still sort of waiting to see how that might pan out. Deanna, do you have any thoughts on that or updates on that?
I do. Actually, I got to visit with Bertha this week, and she, though, when I said something about baby day, in her response, she said, "Oh yes, we're gonna do oh, it's not baby day, it's the other one, Niños, Dia de los Niños." So I don't know if we can do it at the same place. But she didn't, when I said baby day, she said, "Oh yes, we're doing that already," which really they're two different things. So we'll need to have a conversation about that and maybe how we could do that. So.
Yeah. Okay, cool. Well, it's a start. It is definitely two different things. We tried to merge them last year at the Hays County Justice Courthouse downtown. But what ends up happening is that it's just not a baby space, and we're definitely looking for spaces that are safe for babies to be doing baby stuff, crawling on the floor and so it's just a very different vibe. So that's why this year we wanted to be sure that we separated them, because we felt it wasn't as great. Okay, awesome. Yes, we would love help with any of this. And Alex had to hop off, but she is, as a first 3 years representative, she's definitely the main point of contact if anyone is wanting to be involved. And but I do know that they are being much more directive this year. They are offering, specific activities. So if your organization wants to be part of Baby Day at the library or in Caldwell, hopefully we'll get that figured out. We'll see that they're providing specific activities, and then they can even provide with some help with getting materials and such. So it's really just about getting that organized and showing up. Yes, Mary.
So we have been part, the Parents as Teachers has been part of the Dia de los Niños at the library for the past few years whenever they've had it. And it's usually like earlier in the day. I'm wondering if we can merge it to be like just one set day and be Dia de los Niños in the morning, and then maybe a baby day specifically to bring all the babies in and to crawl around, like you said, Nina. So Miss Deanna, maybe you can bring that idea to the table the next time you meet with Miss Bertha. That way it's all in one day, and we just have that separation of the time blocks. Just throwing it out there.
I'm glad you did. I just haven't gotten back to her because I knew being the same place they had issues. So I thought, okay, do we try to do it somewhere else? But then I think we're going to lose a lot of people because they have a baby and they have a 3-year-old. And so how can you be at both? So definitely, if getting some help, and I'll go back to Bertha, we can work on it again.
Or even, I know the library, because it's so big, they have that outdoor space as well, that maybe we can utilize Baby Day within a certain space of the library. It can still go on at the same time, but use the same space, and then have Dia de los Niños in a separate area. Because like what you said, there's multiple kids in one family. So I'm just throwing it out there.
Thank you, guys. I love that. Yes. And when I said that it wasn't working it just didn't work very well for us in Hays County. So but I think with Caldwell being a different space, different population, and still sort of growing that. That is a wonderful idea. Thank you, guys. Some of the other stuff we have coming up, and these are going to be some great opportunities for collaboration amongst agencies. Like we mentioned before, the Help Me Grow initiative and implementation and this coalition has received a lot of resources. And so we are just like trying to throw them all out there in the form of basic needs and all these other things. So the first things that we're trying to get coordinated are sort of these safety first events throughout Hays and Caldwell counties. We're hoping to have at least 3 this year. And I have a feeling that we could probably squeeze in another one if we can figure it out. So the idea is that we will distribute car seats and household safety kits. This will be something that parents will have to pre-register for, because we will only have, you know, X number of car seats available at a time. Upon the, their attendance, they'll, sit through a car seat presentation so that they have a better understanding about how to install car seats, how to keep them safe, all that good stuff. And then once they're done, we'll just go ahead and distribute everything and they can take off. So nothing too crazy. So we have tentative dates for February, May, and October. Those are my goals. So hoping in February that we can get one in late February, that we're going to have one here in San Marcos, and then looking for May and October dates to have them in different areas, because they definitely want to spread those things out. Personally, for me, it's just a little bit easier to organize things in San Marcos because I'm just so much more familiar here with, the spaces and places and all that good stuff. So this is where, collaborating with you guys comes in handy. We would very much love to be able to have car seat events in Caldwell County, and especially, try to coordinate maybe even for more of those rural areas in Hayes, Dripping Springs, Blanco, Wimberley. Those have been really difficult places to get through, and I'm working on getting contacts there. So definitely, keep us in mind and follow up and via email. And I see that there's some stuff happening in the chat here as well. Want to make sure that we are spreading these resources out the best we can. So if you feel like there's an ideal spot, last year for the car seat event, we went to Bonham, which is what I'm hoping to do this year as well. And what made it really great, having it at Bonham, was it's already an early childhood space, and we wanted our parents to be familiar with where it was. B, they had it, it's a perfect setup because we were able to have the presentation in the cafeteria. And then the parents got in their cars and basically just went through the drive-through, the drop-off lane. So, because the school is already set up in that way to have the drive-through that goes in one way and out the other, it made it really easy for them to drive through. They gave us the voucher that said how many car seats they were going to get, and then we just put the car seats in the car and said goodbye. So that made it really easy. So if you're thinking of spaces in your communities that might do really well for this sort of setup, just to make it easier on the day. Let's see here. Yay, booking stuff at the library. Hi, Jen. We missed you last time. Awesome. Okay. And then after that, so we've got books, blocks, and balls, developmental screening events. And these are some things that real specifically go back to some of those strategic planning initiatives that we were looking at earlier. So books, blocks, and balls, the idea is that we have a large space with a lot of different ASQ materials. We have providers that are experts, right? That are child development experts. We have money to be able to pay people to come to do this. So, it's not, we don't necessarily need volunteers, but we do need experts to be able to come and interact with the families while they complete ASQs. So the idea is that we will have ASQ online available, and that the families will be able to sort of go through these different stations, complete ASQs, and then have a child development expert there that they can talk to and ask questions, right? So this is meant to get kiddos screened, and get families information about what developmentally appropriate activities are, right? What are milestones? And really trying to engage parents and give them the knowledge that they can learn how to observe their children's behavior, right? And observe their children's development on their own. So, this is a double whammy. We want to give them the information, but we're also getting them in so that we can get at least that one screening from between 0 to 3. So I'm really excited about these, and it's a big undertaking. And this is what we're sort of hoping for. So we're hoping we have already something, oh no, so on March, we'd like to do one in San Marcos. So once again, we're looking at either the library or the activity center. So Jen, just to keep you on our radar. And then June, and these are all tentative, these are just thoughts. Hopefully maybe June in Lockhart, September somewhere in the Buda Kyle area, and then in December in that Wimberley, Blanco, Dripping Springs area. So really trying to just, you know, get involved in all the different communities. So this is really going to be a great way to collaborate. You know, providers from your agencies who are child development experts are already doing some sort of work, direct practice work that could come out on a Saturday and be paid to do a couple hours work. And then also looking for spaces and assistance with really getting the word out. So these will probably, again, be things that parents will need to pre-register for so that we can make sure that we have everything we need. And then, you know, if, you know, the space allows that we can have providers that might be able to table in a different area to provide additional information about resources. So these can be some really, really great opportunities for families to get a lot of very necessary information about development. And a lot of the stuff that we'll be giving out is you know, lots of different types of swag, information on child development, books, right? We want to be sure that everyone's leaving with books, things like that. So definitely, I'll be following up. But if your wheels are already spinning and you're already thinking about things, please, you know, email us or put something in the chat, and we'll be able to follow up with you. So does anyone have any other thoughts, ideas, or suggestions on this sort of very tentative calendar?
Hey, I just wanted to jump in really quick and say that when we talk about these being events that we're hoping to host and facilitate, these are things that Nina, as the coalition coordinator, and myself, in my role as the home visiting director of community action, would be kind of like spearheading and really hoping for support from the coalition to facilitate. Though certainly Nina is kind of the primary contact and would be doing a lot of the lifting. I just wanted to clarify that in the chat, Jen. I totally deeply understand your concerns about staffing shortages. I think many of us on this call know what that feels like. And I just wanted to clarify that if like the library were to host an event on behalf of the coalition, it would not be expected that the library would staff single-handedly the event. And that goes with any coalition hosted events, that if your organization is supporting it by hosting or providing certain resources, that the coalition will step in to support that. And we hope that some of you all would even be able to lend some of your time day of for these types of things. So
yeah. Thank you for clarifying that. Yeah. And also, just thinking about, you know, if you guys have access to people who already volunteer, you know, as far as that goes, you know, we've had volunteers that help us with our car seat distribution events that come from different places, you know, college students, civics clubs, things like that, right? And they're always happy to come out and just be an extra pair of hands for a couple of hours. So even just connections to volunteers in your community, things like that. So I just know that we all have a lot of different resources and connections and spaces and things like that. So when we talk about collaborating, that is really definitely the goal, is that we want to just make sure that everyone is engaged and that everyone has an opportunity to add to you know, these projects. But definitely don't feel like we're going to put the brunt of the work on you. We've got this. It's good. But we want to be sure that it's community driven. And since you guys know your communities so much better than I would, you know, coming from Caldwell or you know, rural areas of Hays County, definitely just want to tap into the stuff that you guys already know. Awesome. Yes. Yes, thank you so much. And that's, Amber, that's very much, I'm hoping to be able to sort of get either ECI providers or, you know, potentially home visitors, people who are trained and, you know, happy to be doing direct, you know, work with families to kind of help with these books, blocks, and balls events. That's not something that I would want to. Thanks, Jen. Have a good story time. That's not something that I would want to put in the hands of a volunteer. And like I said, we have money to pay for those providers to come, so that would not be a burden to them.
Yeah, I would love to, you know, if you pass, when you know a little more, pass information along, you know, maybe some of our, you know, EISs may even be interested in coming out to assist with screenings or that kind of thing. I can for sure at least pass it along. And, you know, and then we can be there too, that, you know, if you have families that maybe, you know, they fail the ASQ or whatever, then, you know, we're there to give them resources as well.
Perfect. Yes,
Yeah.
wonderful. Thank you. Yes.
Thank you.
Awesome. All right. Well, we've only got 10 minutes left, so I'm going to go ahead and move on. And we talked about project work groups a little bit, and I know that we've had some people that needed to jump off, so don't worry, we'll be following up. But there was 3 ideas for project work groups. That doesn't mean that we need to do all these ideas or even any of these ideas, but we're definitely looking for ways that the coalition can be a little bit more engaged in some more specific type stuff. And once again, this is stuff that is like, you know, the reason we want to create project work groups is to give you guys an opportunity to work on some of these things a little bit more specifically, but also because we serve such a vast area, I want to be sure that we've got, you know, representation and voice coming from all these different areas, right? So some of the ones that we thought about were early care and education. That's something that I know the Wilco Coalition does, and they specifically work on sort of that professional development series, right? And reaching out to and supporting those early childhood education providers. So it's sort of like a specific work group for that, where you would figure out, well, what are some needs and how can we meet them? And we could take time in the coalition meetings sometimes, or, you know, just have these meetings separately. These are all new for us in this coalition, so it'll take a while for it to get some momentum, but these are just the ideas. Also community outreach, like a lot of those events on the calendar, right? If there was a community outreach work group specifically that would sort of help to plan and organize some of these things. And then also healthcare provider outreach. How can we really engage our healthcare community? We all know that that's always been the biggest struggle, right? Is getting the doctors and nurses sort of engaged and on the same page as us. And so, you know, having a work group that specifically makes, you know, creates strategies and tries to think through ways that the coalition as a whole can really use to engage these difficult populations to reach. So those are just some ideas, and we can definitely talk about this more. But we will probably be starting, we will be starting with an early care and education work group because we're already doing the professional development series. So if this sounds like something that you would like to be a part of, please reach out, and then we will go ahead and organize a meeting time for that. But I know that our first at least one meeting will be held in April, when we evaluate all the information from the professional development series. Okay, so we're going to rush through this because we have 7 minutes, but this is the Bright by Text info, and I'll let Megan take this on. She's our Bright by Text expert.
Sure. Yeah, so we are in a new calendar year, but this data covers the last 2 months of 2023. Currently have 440 active accounts, and which means individual caregiver subscribers and 560 children. You can go to the next slide. Thanks. Yep, this is our sign up activity and our unsubscribed activity for November and December. Looks like there was a peak in November for whatever reason. To be honest with you, I speculate sometimes that folks in Hayes or Caldwell end up going to events in Austin, potentially, and they see information about Bright by Text. And when you sign up for Bright by Text, it is specific to zip code. So anyone in any community can reach out to Bright by Text if they see any kind of advertisement, and it'll sign them up to receive messages in their community specifically. The reason that I speculate that maybe some folks were traveling in a bigger community, more metropolitan area that signed up, is just that I am not aware of any big push that has happened in the last couple of months. So yeah, just interesting to see that we had 13 subscribers in November. And then a few folks dropped off in November and December. I don't have any data that gives me any reason why, other than maybe sometimes folks don't want to receive automated text messages anymore, and regardless of how great and high quality the information and content about child development can be. So you can go to the next slide, Nina. We had one community message that went out in November. It was Workforce Solutions Rural Capital, information about childcare scholarships availability. You can see there the number of recipients is 73. This is because it really was a specific message to the 78666 zip code. So the number of subscribers total across Hayes and Caldwell is that 440 number that we saw on the first slide of Bright by Text data. So 73 of those subscribers are specific to the 78666 zip code and have a child that is under the age of 4, which were the parameters of this message group. There were 14 URL click-throughs from the text message, which means that message had a unique URL link to the childcare scholarships landing page. And so 14 folks clicked on that URL, and that was a 19% click-through rate, which is relatively high, honestly, from our Bright by Text messages. Be really interesting if we had any follow-through data to know later on down the road if, you know, of those 14 folks, how many of them any followed through with completing the application. But this is what we have specific to Bright by Text. You can go to the next slide. And just a reminder about completing our community message request form to have your messages sent out through Bright by Text. Nina, if you scroll on that page, it should scroll down through the Google form to show. If you like move your cursor over.
No, I had to switch it to PowerPoint, and so then it changed the thing, and I had to.
Oh, I see.
Yeah, sorry.
I see. That's okay. You can use the tiny URL link there. It is a really simple Google form that captures all the information that we need in order to submit messages to the Bright by Text platform. And which all it needs to be is that it is a free event or service that is related to supporting caregivers. So if your organization is offering free services to families with young children or to caregivers, a service or an event, we would love to promote it out through Bright by Text. You can use that link there. If you have any questions, please feel free to reach out to me. My email address will come up at the end slide. You can also always just reach out to the Start Smart email address that gets directly forwarded to Nina and I both. So one of us will see it and get back to you.
Awesome. Thank you so much. And I forgot to ask at the beginning of this, because my brain is still foggy also, if you are able to just type your name in the chat so that I have a sign-in sheet for the meeting. Because I totally forgot to ask you guys to do it at the beginning. So, so real quick, an advocacy opportunity, as you know, Proposition 2, which created a tax exemption for property taxes for childcare providers. went through, and so there is a webinar happening January 30th from Children at Risk that will give you some strategies on how to make sure that it is actually implemented in our community. So I will include this information in the follow-up email. Just a quick reminder about our coalition member agreements that will outline memberships of benefits of membership, but also just make sure that we always have a point of contact in your agency. And that was always be included in the follow-up. And I know we only have a minute left, but just in case, is just any other announcements or things going on at your agency that you would like to share? Okay. So once again, Megan said, you know, if you would like to contact us, y'all know the Start Smart email. Y'all will be hearing from me with a follow-up email, and then next week I will be sending out a survey to get some feedback on our strategic planning. But yeah, otherwise, I'm looking forward to hearing from everybody. Thank you so much for your time. Our next meeting will be March 26, 2024 at the Village Main. We will be working on having hybrid available. We'll be new to hybrid, so if you log in and we have issues, bear with us. But we would always love to see you in person, and as always, a light lunch will be provided. So if you can make it in person, we would love to see you. But otherwise, thank you guys so much for your attendance today and all of your input. I'm really looking forward to 2024 for this coalition and all the different activities that we're going to be able to do together. So please feel free to reach out if anything comes to mind. But other than that, we are done. So happy Tuesday and have a wonderful rest of your week. Thanks, guys.